Hi, I'm Dr. Kelly Starrett with H-Wave, and today we're talking about how we might use H-Wave technology to enhance and work on recovery after movement. So sometimes we always think, hey, H-Wave is always about surgery and it's always about chronic pain, but oftentimes we forget that we can deploy those same tactics, same device, when I'm just sore, or hey, I'm out of my acute phase, but my back is a little achy after loading it. So one of the things that we love about having an H-Wave on hand is that in the situation with someone with kind of chronic low back pain or history of low back pain, eventually we're going to start loading and moving the body. Remember, this is a device which ultimately allows me to move. It gets movement in the system, or it creates a window of opportunity where I can go load. And that loading may be walking, it may be gentle yoga, it may be powerlifting, it may be deadlifting, right? But the bottom line is, oftentimes when we have people who have a history of low back pain or history of low back trauma or surgery, when they lift, they'll get a little bit stiff. And one of the things that we have accessible to us is the ability to just get non-fatiguing muscle contraction into the paraspinals. So in this situation, I've got one pad on one side, one set of pads. I've got the lead from the other side, the B lead, on the other side. And what we're going to do is just turn this on. This is Juliet. She is my partner, and I am comfortable dialing this up for her. Or normally, if this was a patient, I would give this to her. But you're seeing now that we have just this non-fatiguing muscle contraction going. And it's low, we're only in the low setting, but I'm already getting enough of a muscle contraction that we're getting some effect here. And what's happening here is, because she's got a little achiness, a little soreness, we're going to see that those muscles may get a little bit tight or a little bit tonic. It's one of the ways the brain can protect itself or protect a joint system that maybe has a patina of history, a little bit of trauma, a little bit of wear and tear, a little bit of show. And what's happening here is that Juliet now is getting this pump out, which is going to bring in blood flow, and it's going to reduce congestion, and it's going to allow her brain to continue to receive movement, signals that it's safe to move here. And so what happens is that even though Juliet may not have a perfect spine like she did when she's a toddler, because we're still going to need to load, we're going to need to train, we're going to need to compete with a back that does these things, this gives us a way of de-escalating that soreness, that tightness in that low back or in any body part after sort of exercising or after loading. And that loading just may be my job or carrying my kid. But having access to being able to restore movement and get blood flow back in enhances the recovery and closes that loop of adaptation response to exercise or load. This is one of the reasons that low frequency is such an amazing sort of tool in your tool belt should you find yourself a little bit sore, a little bit stiff after loading your back or any tissue in your body.